Hi guys, this is our last video for respiratory system. This is going to be homeostatic imbalances of the respiratory system. So this is video number 5. Okay, so let's talk about imbalances. So there are a couple listed in your guided notes. This is by no means all of the imbalances that can go wrong with the respiratory system. I just chose a few that I thought were, things that you might be familiar with, have heard of, know somebody who has, okay? So the first one is COPD. Okay, so what is COPD? COPD is an acronym that stands for chronic obstructive pulmonary diseases. It's a group of diseases. Chronic means it's ongoing. Obstructive means there's something in the way. Pulmonary refers to the lung. So this is kind of like a broad umbrella. And then under that umbrella, there are several examples of COPDs. Many people who have COPD have a history of smoking. Some of them have exposure to something environmental. And some people have COPD that's been connected to asthma, that they've been an asthmatic for many, many years. Whether or not the asthma has been managed well is not something we're considering. So these are some things that can put you at risk for a COPD, okay? What it can lead to is things like difficulty breathing, coughing, frequent pulmonary infections, and respiratory failure if not treated at all. So something like, for example, so we'll put these as examples. Chronic bronchitis. If something is chronic, it means it's ongoing. Now, you can have acute bronchitis, which could be something infectious that some people get yearly or every couple of years. What bronchitis generally means is you have inflammation of the bronchi. And if the wall of the bronchi is inflamed, it will swell, and that will narrow the lumen of the bronchi, therefore narrowing the airway. So that's the obstructive piece. There's something in the way. If it's chronic bronchitis, it means that the patient is symptomatic for at least 3 months of the year. So this is an ongoing issue that's causing things like difficulty breathing, wheezing. In some cases can cause things like tachycardia, where your heart rate is accelerated. One of the things that happens with chronic bronchitis that really can cause patients a lot of issue is you have the buildup of a lot of mucus in the airway. And so a lot of the coughing is designed to try to bring up some of that mucus. So one of the things that sometimes is prescribed for chronic bronchitis are drugs that are classified as something called mucolytic. So muco for the mucus, lytic, the word lyse means to break open. So it's something that's going to help break down and thin the mucus so that when you cough, it's easier to expel the mucus as part of the sputum. Okay. Another example of the COPD is emphysema. Okay, there are 2 different types of emphysema. There's type 1 and there's type 2. The one that most people are familiar with is type 2, which is correlated to a history of smoking. However, type 1 is a genetic form of emphysema where you have breakdown of the elasticity of the lungs. And when you lose recoil of the lungs, you lose what's called compliance, and then more energy is required for you to take a breath. So we're not going to focus on the genetic type. We're going to focus on type 2. So what happens in someone who has emphysema is the alveolar walls kind of break down, they deteriorate. You can also have air trapping within the alveoli because in some cases the alveoli become kind of permanently enlarged and then start to deteriorate. And if you have this kind of stretching of the alveolar wall, you're going to get air trapped in the alveoli that can't quite leave. And then you get kind of these swellings. Those are called blebs. And those can be very dangerous for an emphysema patient. The treatment for COPD, so obviously mucolytic treatment is really not going to work for someone who has emphysema. So if you were going to just take that off the table for a minute, how do we treat COPD? Well, the real problem we have is we're trying to make sure that we've got enough oxygen coming in, but the real problem is expelling the appropriate amount of carbon dioxide. So to treat COPD, you can do things like a breathing treatment. And that treatment may include, or usually does include, some sort of bronchodilator. What that means, bronchi, dilator means it's going to try to relax and open up that airway. There's fast acting and slow acting bronchodilators. Ones that act very quickly would be something like albuterol, but they don't last for a really long time. So they have slower acting bronchodilators that could be put into a breathing treatment that someone would get relief for several hours after the treatment's been completed. In addition, you could look at things like anti-inflammatories. Some of these might be taken orally. Some of these might be inhaled. So you have things like corticosteroids. You have what are called leukotriene receptor antagonists. Things like Singulair, which are good at reducing inflammation as well. Sometimes you'll have treatments that are combinations of a multitude of different drugs. In addition, long term, you give supplemental oxygen to someone who has COPD. One of the risks that can happen is with COPD, if someone is chronically not getting enough oxygen, their tissues aren't getting enough oxygen, their heart is getting the message that it should try to work harder to try to pump blood and deliver oxygen. So sometimes this can put a great amount of stress on the heart, and it would certainly put someone at risk for a cardiac event. Okay. In addition, someone who has emphysema is going to have a lot of difficulty getting rid of the appropriate amount of carbon dioxide, and so may develop respiratory acidosis, which is very dangerous as well. Asthma. Okay, so asthma is characterized also with coughing, wheezing, difficulty breathing, which is called dyspnea, and chest tightness. What it is usually brought on by is someone has inflammation of the bronchioles. Sometimes you can get the production of increased mucus into the bronchioles as well, which we won't really touch upon that. So typically what happens is someone who is asthmatic has kind of got this chronically inflamed state in their bronchioles. So again, it's the wall of the bronchioles that's swelling, and it's narrowing the luminal space so that less air can pass through that space and make its way towards the alveoli. So when someone has asthma, they usually have what are called asthmatic triggers, which could be something inhaled. It can range from something like ragweed or pollen is a trigger, dust mites that are a trigger, smoke, that can be a trigger, perfumes, all sorts of inhaled chemicals can be triggers. If you really want to treat asthma well, I would advise that someone would want to identify the triggers and avoid them, but sometimes that can be really difficult to do, especially if someone has many, many, many triggers. It might be all but impossible to avoid them. So typically the way that asthma is treated, I want to pause here for a second and say that asthma, if someone can die from an asthma attack, I think people kind of take for granted that people treat the asthma and survive with it, but it can cause damage and it can be fatal if someone's having an acute asthma attack and does not have their inhalers or a remedy near them. So step one is we want to try to avoid our triggers, right? But step two, we can take what's called a rescue inhaler. In the event of an acute attack where someone is really suffering, they would take, that should be a C, a rescue inhaler. And again, that would include, for example, something like albuterol, which is a bronchodilator. It's a class of drug called a beta agonist. And then the other thing you would take is a maintenance drug, so something that's going to kind of like an anti-inflammatory. And the goal there is you're trying to calm the inflammation so that you're kind of maintaining the inflammation at a very low level. And again, if we're trying to avoid our triggers, then we're trying to prevent the chest tightness, the wheezing, and the real gasping for air that's coming on with an acute attack. Okay, last couple, I promise. Next one is tuberculosis. Okay, TB. TB is a bacterial infection. The bacteria is named, the disease is named for the bacteria that causes the infection. So tuberculosis is curable. It is I believe, one of the leading causes of death from a curable bacterial infection. So we think, well, why is it still around then? Okay. Tuberculosis has two forms. You have latent TB and then that which is non-latent. Latent is sometimes called asymptomatic TB, and non-latent would be symptomatic TB. The signs and symptoms of tuberculosis would be things like fever, chills, night sweats, coughing up blood, difficulty breathing, okay? Someone can test positive for tuberculosis and have no symptoms. That's classified as latent TB. Now, latent TB can become symptomatic, so it's still a risk. If someone is experiencing symptoms, then they have the symptomatic or non-latent form of TB. So what happens is, if you want to work, especially in a hospital or a nursing home or somewhere where you're in the healthcare field and you're in contact with a lot of patients, tuberculosis can be spread by airborne droplets, similar to COVID. And so because of that, even if you have latent TB where you're not symptomatic, they want to treat you for TB. And a lot of people are very resistant to that. So why? The antibiotics that are prescribed, you can take a course of antibiotics for up to 9 months, in some cases a full year, and they have side effects. And so a lot of people, this is daunting to think of taking an antibiotic for 9 months. So the problem is sometimes people will start treatment for TB in good faith, of course, and then, they're not sick. So they stop taking their antibiotic, and then what happens is that bacteria has kind of seen that antibiotic and now develops resistance to it. So a big problem with tuberculosis is now we have what's called multi-drug resistant strains of tuberculosis. Okay. Obviously, if something is drug resistant, the old antibiotics that you would have given to your patient obviously aren't going to work anymore. Okay, the last thing I wanted to talk about quickly was lung cancer. Okay, so lung cancer, most of us think about lung cancer, we think about smoking. And smoking is definitely a risk factor for lung cancer, okay? And I would argue smoking all kinds of things, not just cigarettes. Vaping, I don't know what the story will be with vaping long term. I don't think there's a ton of evidence that supports that it's good for your lungs, but I don't know if there'll be a correlation with cancer down the road, okay? There are many, many different types of lung cancer. Now, that being said, you can have lung cancer localized to just a lobe of the lung or one lung, so potentially you could remove one area of the lung. The different types of lung cancer are speaking to the different types of tissues that are affected when you have certain types of lung cancer. So for example, small cell carcinoma affects lymphocyte-like cells that are around the lungs that are clustered in the mediastinal area. So that's a very specific type of cancer for that cell, okay? Obviously, if we're smoking, we want to stop. Smoking is dangerous for a variety of reasons, but one of the things that's released when you ignite things is something called a PAH, polycyclic aromatic hydrocarbons. Those are known carcinogens. So this is why we don't stick our face over the fireplace and take a big breath in when we light a fire, okay? Because we don't want to inhale those chemicals. That's why you have a flue and you vent when you have a fire. Okay, lung cancer, the treatments. So we can go with the classic radiation. Obviously surgery. So we have tumor removal, radiation, chemo, and there are many types of chemo. Chemotherapy is chemical therapy, and it can be administered in many different ways. For example, you can give chemotherapy in a pill form or an intravenous form. It depends on what type of chemo and what type of cancer the patient has, the age of the cancer. There's a lot of factors involved when prescribing the appropriate chemotherapy for the appropriate amount of time. And then there are also immunotherapies that's associated with treating lung cancer. And those just use a different mechanism of attack. Many of them use something your immune system is already doing to your advantage. Maybe not to cure or get rid of a tumor, but slow down its progression, right? So, and that is important because that'll prolong the patient's life. That's going to do it for all things disorders for respiratory system. Our next video series will be your lymphatic system.